You've been sent by a doctor for a hearing exam. Good. Have you already had a medical checkup? Wonderful. Please do come on in and take a seat at the exam chair in front of me. Thank you. Let's quickly get you all signed in. So, looking at my online appointment sheet as well, I do have someone scheduled in for a hearing exam, hearing test and ear cleaning. Sounds like you. Could I grab your name? Thank you. Double checking off on the name. Could I get your birthday? Thank you. Same as before. Same home address. Great. And what's been bothering you? Okay, so lack of ability to hear soft sounds. And would you say that, okay, so not able to hear sounds you were once able to hear. Have you heard any ringing in your ears as well? It's known as tinnitus. Okay. And have you been listening to loud music recently? Or perhaps had your headphones in and did not notice the volume? Okay. Do you listen to loud music in the car? Okay. Thank you. So, we're going to do a very thorough ear exam today, including an ear cleaning and a lot of hearing tests. What I want you to do is just relax. Good. So, first thing I'm going to test is, if I may, touch your ears. Thank you. I would like you to close your eyes and you tell me what side you hear sounds on, left or right. Good. So, very carefully going to just close your eyes. And you let me know if the sound is coming from the left, the right, or both sides. Good. So. Good. Good. Okay, inability. Okay. You can open your eyes now. I'm going to write this down. But it does appear that your ears are experiencing lack of response to left and right. And we're going to test this out with further hearing exams. I'd just like to get a basic one done first to make sure that we know what's going on, okay? Good. So, first, just going to do a basic ear examination, and I'm going to get my otoscope and a Q-tip as well. May I touch your ears? Thank you. So first, cause tinnitus? Any ringing? No. Good. Very carefully. Okay. Other side. How's that feeling? Okay, I'm going to cup both ears like this now. May cause a sense of uneasiness. Okay. Your eyes appear to be a bit wavering, so do you feel a bit like your equilibrium is off, a bit like vertigo? Okay. I'm going to look into your ears with an otoscope now and a Q-tip. So, got my tools here. I'm going to quickly take a look. So first, I'm just going to take a look. Okay. Looking into the other ear now. Just going to grab my tool here. Going to just okay. Quick check of your eyes now, too. Okay, look to the ground. Look up. Okay. I'm going to point this light into your sinuses. Your sinuses are here and here, and they're connected to your ears. Have you been sick within the past month or so? You have a lot of wax and ear buildup that I am going to remove. You were okay. So I'm just going to point this right into your sinuses. Just going to take a quick look here. Okay, inflammation in the sinus is confirmed. This makes sense in the condition to your ears. So, onto the ones into the cheek next. So, I'm going to just very carefully put that on the cheek. Okay. Inflammation and very carefully there. Inflammation. Okay. And going to do a very thorough ear cleaning now. Going to begin with getting on some gloves and applying a earwax cleansing oil. Good. Just relax. Okay. Now let me get the oil. So I'm going to apply a couple drops into each ear, then massage it in. this ear now. Okay. And now I'm going to massage it into the ears. So, here we go. Now I'm going to get a particular cleansing solution, which will help with the sterilization of the ear. Here's the first cleansing solution. Just going to very carefully get a bit of that. Just going to cleanse the ear. Good. Next is a cleansing foam. Got a bubble leaf cleansing foam. We're going to apply this into the ears. Very carefully onto the ears now. Grabbing a bit more now. We're now going to massage that into the ears. I'm going to get some on the gloves. Just sit still. Okay, relax. Just going to clean this into the ears. now, I'm going to just get a cleansing cloth and clean off the ear with another antibacterial medicine. Good. Okay. A new cotton wand and another medication to help cleanse it and sanitize. Perfect. Now, let's cleanse each ear. You feeling okay? Good. So, other ear now. Okay. Wonderful. Next, we're just going to use one more Q-tip to clean around the ear and make sure that it's dry. Okay. Here we go. Does everything feel okay with this ear? Good. On to the second one. So just very carefully. Okay. And is that ear feeling dry? Marvelous. We got a lot of wax buildup out of there. Do you feel like you can hear a bit more now? That's what I thought. Let's finish off the hearing exams now. And let's see how your ears perform, okay? Good. So, I'm going to take these gloves off. And sit still. first I'm going to do a basic sound exam like we did prior. Then we're going to do a hearing range test. Lovely. So, close your eyes. Tell me if the sound is coming from the left or the right. And relax. Close your eyes. Good. Wonderful. Good. 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 Okay. Good. Great. Your performance on your ears is very good in comparison to the first time. The improvement is fantastic. Now I'm going to do some hearing sound tests for a range of sounds. Good. Let me get my computer. Now that I have my computer, we're first going to test the human hearing range. I want you to let me know when, by saying when, you hear the first sound. Thank you. Okay, that was at 6 decibels. That's perfect range. I now want you to let me know when the sound is very clear by saying when. Good. So, here we go. And that was at 15 hertz. Perfect range. 14 hertz is very normal. 15 is A-okay. Now we're going to start at low hertz, 500, and increase. And I want you to let me know when the volume becomes very clear. Could you hear that? Good. Could you hear that? Good. And how about that? Good. How many tones were there? 2. Could you hear that? Fantastic. And finally, can you hear this? Yes, that is 8,000 hertz. Perfect. I have now confirmed that your hearing is crystal clear. Do you feel better? Good. That's just my job as a doctor, just to make you feel better. I do thank you for coming in today. We're going to send you your hearing results as well in a package formula, and I'm going to send you a guidance on how to take care of your ears at home. If you ever need to come back in for another hearing test, or perhaps an examination of the ears, a more thorough one, let us know. If you feel any irritation in the ears as well, or pain, please come back in. Thank you so much. I'm going to be writing my report on your hearing test now, and I'll send it to you in the mail. Great. Thanks for coming on in. Again, I'm Dr. Luna. Have an amazing rest of your evening.